Good evening, CAN TV viewers. Thank you for tuning in to the Doty Report on Comprehensive Health. My name is Yolanda Gibbons, and I am the host for today's show. The Georgia Doty Comprehensive Health Organization is a non-profit organization that has been serving the Chicago community for 20 plus years, have really been an advocate for bridging the gap on the health disparities that we know oftentimes exist within minority communities as it relates to healthcare resources and quality healthcare. Our show talks about everything as it relates to just wanting to provide information for folks in the community to live healthier lifestyles. So I am excited today. Some of you may know that last month, the month of May, was Hepatitis Awareness Month. And I was just chatting with the doctor over here about recently, probably maybe in the last couple of years, that I began to notice like commercials and the campaigns to kind of raise awareness on hepatitis C, and I was asking her, like, what's that all about? So she is here today to enlighten us and educate us and inform us and hopefully be able to provide you viewers with some great information. Don't forget that you can call in to ask questions and or make comments. So let's get to it. I want to introduce, I know I'm not going to pronounce her name.
Go for it.
Dr.
Adeyemi. Yes.
Adeyemi.
Yes.
I got close. And she is an infectious disease physician for Cook County Health. She is an associate professor for Rush Medical School, right? And did her residency for UIC. So she a true Chicagoan. Yes. At least now, right?
Yes.
She's a true Chicagoan. And I am thankful, for you being here today. So you want to share a little bit about you before we start talking about
hepatitis C? Okay, my passion, hepatitis C. So like you said, I'm an infectious disease physician. I practice at Cook County Health, and which is obviously right here in the city of Chicago with our 2 hospitals and multitude of clinics. And I've been with Cook County Health since 1999 as part of my fellowship training in infectious diseases, and worked at the Core Center where we take care of adults living with HIV and viral hepatitis and other infectious diseases. So so trained at UIC, did my fellowship at Rush Cook County, and I've been on staff at Cook County almost 20 years now. So really excited to be here today.
Okay, so let's talk about what is hepatitis C.
Okay.
Because I'm not sure people really know when you say that what that really means.
Yeah, so hepatitis just means inflammation of the liver.
Okay.
Simple, inflammation of the liver. And with that means that there are so many things that can cause the liver to be inflamed, including medications, alcohol, toxins, and viruses.
Okay.
So hepatitis C is in the class of viruses that can infect the liver. And it's actually one of the most common infectious diseases in the U.S. with a lot of people living with viral hepatitis. So there's a lot of different hepatitis viruses, and sometimes people come into the clinic and they said, I got a vaccine, I got a shot, is that hepatitis C? I think I got one when I was a kid. So the ones we really talk about that give you chronic liver problems are hepatitis B and hepatitis C. Okay. So hepatitis A you can get usually through food or eating contaminated food products, and there is a vaccine to prevent that. Hepatitis B and hepatitis C, very similar in terms of how they're transmitted, and they're viruses that infect the liver and can cause chronic liver disease and liver damage. So hepatitis C is just one of the viruses that can infect the liver, and it's pretty common.
Okay, and is there an age range that you see more likely than not that are being diagnosed with hepatitis C?
Yes. That's a really good question. So in the U.S., it's thought to be somewhere between about 2% maybe of the whole population has hepatitis C, but that varies differently in different groups and in different age groups. And what the Center for Disease Control found about a couple of years ago, actually more than a decade ago now almost, was that the largest number of people, so 75% of people living with hepatitis C in the United States were born between 1945 and 1965. So we call that birth cohort, the baby boomer cohort, right? I missed it just by a little. But that cohort, so, we've always had, since we knew about hepatitis C in the 80s, there have been very good guidelines about who to test for hepatitis C. And, we know that people living with HIV, because of similar ways of transmission, needed to be tested for hepatitis C. People on dialysis, people who got blood products in the 80s and 70s before we knew about hepatitis C. So we always knew about people on dialysis, people with active injection drug use. We always tested. But we also knew that there were a large bulk of people who were coming into the hospital with really late liver disease and finding out they had hepatitis C. And they looked and said, 75%, that's 3 out of 4, were born with this age group. And so what the Center for Disease Control did was, in 2012, they said anybody born between 1945 and 1965 should have a one-time hepatitis C test to look for infection they're not aware of. And so that was a guideline in 2012. And in 2013, something called the Prevention Task Force, the U.S. Prevention Task Force, endorsed it. So it wasn't just the CDC. Now we have the organization that guides when we do, vaccines and screening tests. Also said this is a good thing, right? If 3 out of 4 is in that age group, that's the age group that should be tested. So now we're about 7 years into these recommendations, and we're really still not getting the uptake we need in terms of primary care providers testing, because a lot of times patients don't have symptoms. So you're seeing a lot of commercials now because we have cures for hepatitis C. There's a lot of awareness about it. There's data that, we can cure the virus. We know that for sure. And that when you do that, you can improve liver disease and reduce the number of people who need a transplant or who get sick. So there's increasing awareness, but programs like this are still very important, so that if the primary care provider isn't doing the testing, that the community, the person is saying, hey, wait a minute, have I been tested for hepatitis C, to be able to talk about it? So you probably see things in the bus stations and flyers saying 1945 to 1965, have you been tested? And it's a simple blood test.
And talking about blood tests, because, we go to the doctor and we draw blood for the regular physical. And I think people are just beginning, like you sharing this information, that does not mean that you're being tested for everything. I don't think people understand that. I didn't until actually a doctor on the show was talking about that. You just kind of think, oh, Texas came back,
everything's
fine.
Good, so everything's good.
But they don't test, so you have to actually ask.
You have to ask, and you shouldn't have to, because these are not new guidelines. They've been around since 2012, but it's for a variety of reasons. One, because for the longest time, because we know that for this virus, it usually is from blood contact. So highest risk group are people who have a history of injection drug use, who shared needles. Some people who got transfused way back then, and so anytime people have to ask about, did you use drugs, even if it was one time, sometimes people get uncomfortable about asking, especially if somebody's older, so they just don't do it. But those are the guidelines to do it. And so what we're finding out is that in our system, so at Cook County Health, what we did was in 2016 we instituted what we called a birth cohort prompt, and other institutions do that too, where you just say, if someone's born within that age group, you can search the electronic medical record. If they've never had a hepatitis C test and they're getting blood drawn for anything, that the trigger comes up and says, this patient was born 1945 to 1965, recommendations are to get Hep C test. A Hep C test is being ordered. And with that, we saw the increase, and we actually provide that back to all of our clinics. So they can actually see what they were doing, what the rates were before and after. So we did a lot of hepatitis C tests in our system because people get tested. If your liver enzymes are off, your liver tests are off. It's one of the things people test for. If you give a history of drug use or substance use, they do it. If you have HIV, we did it a lot. But there was still a bunch of people who just came in for their diabetes checkup, routine physical, who thought they got all their tests done, and they weren't necessarily getting done because they felt fine, and it wasn't getting done. So one of the things we know is increasing awareness to the community, so people can take that power and ask, have I been tested? making sure that healthcare providers are aware of guidelines as they're
Right.
released, and then looking at tools to help, right?
Right.
Because a lot of times we have so many prompts that are coming up, things you have to do, forms you have to fill
Right,
out, prescription
right,
refills.
right.
So if it's not something that's where I'm an infectious disease person, this is what I do, so I see it that way.
Mm-hmm.
But if you're an internist and you have 4 other problems you're taking care of on that visit, and the liver tests look fine, which it can do sometimes, it's
Okay.
not the first thing that comes to your mind. So systems that make it work, figure out how they're looking at the community, making sure they're aware of what needs to be done. They're looking at the providers and educating them, and also looking at how we can help them to do what they need to do. So we use the birth cohort prompt, and it's been very helpful.
Okay.
Yeah.
So what about gender? Is it men versus women, or African Americans versus another ethnicity that you're seeing it in?
Yeah. So again, there is not necessarily a higher rate. So there, most of the there's a higher rate among men.
Okay.
But a lot of it is really tied to risk. So
Okay.
apart from the age group, the other risk group, the highest risk group is in people with injection drug use. So when we talk about the rates in the general population, when you look at certain populations, it's higher. So anyone with a history of injection drug use, and usually a lot of researchers have looked and found that most people who acquire hepatitis C from drug use usually acquire it in the first year of use. So you may see somebody who you're diagnosed, you're picking up, in their 50s, they use drugs 20, 30 years ago,
Right.
sometimes just one time, one
Right,
time.
right.
In the 60s, in the 70s, they're coming in for an insurance physical one time, right? No, but they don't even remember and talk about it.
Right.
And that's why this new birth cohort thing, we don't ask about risk.
Right.
That makes it comfortable. It's not about, did you remember if you use something? It's not about that. You're born in that age group. 75% of people who have it are in that age group, so we're testing you as part of that age group. Because if you think about it, when people are initiating injection drug use, it's probably the first time or only time they're going to share, right? Usually someone's saying, here, try this.
it. Okay.
After that, people have to figure that people know how to do safe needles and how not to reuse and all that. So a lot of people that we're diagnosing in this age group, we're picking up infections they've had for a long time,
Wow.
right? And so the progression of liver disease is not the same for everybody.
We have a caller.
Oh, okay.
Caller, are you there?
Yes, I am.
You have a question?
Yeah, I got hepatitis by serving in the Vietnam War, where the air gun during that period was proved to be contaminated, where everybody got shot with the same gun. And I've had it for like 40-something years, and after having it for this long period of time, I have now liver cirrhosis. So how do I deal with that issue?
So he said that he believed he contracted it while he was in the military with the gun.
The vaccine,
So he's
yeah.
been living with it for a long time, and now he has cirrhosis of the liver. I think that's what I heard.
Okay.
So he's asking, how does he?
Get treated
Yes.
and cured. Okay, so a lot of people, especially if they traveled outside of the United States or had significant exposure in other parts of the world, medical instrumentation, reuse of needles and things, there are lots of places where there's a high rate of hepatitis C. And so like we said, if you look at 10 people, I use this illustration, 10 people with hepatitis C who contracted at the same time, anywhere between 2 or 3 out of every 10 will cure on their own. The body can spontaneously clear this virus.
Wow. Okay.
They will always have an antibody test. So if you test them for Hep C, the antibody test that shows that they were ever exposed is positive, which is why that is not the end be all. So when people get tested in a community fair and all that, all the fair does is, they check for exposure. It doesn't tell us who, the 8 out of 10 who have the virus or the 1 out of 2, the 20% who cleared it on their own. And so what happens is over time, over 20 to 30 years, about 20% of those people who have the chronic infection do develop cirrhosis, so similar to the gentleman.
Okay.
And that is what we call, that's a lot of scar tissue in the liver over years of, the virus, the liver is inflamed. It's like a wound, right? It's hard, it's inflamed by the virus, it heals with scar tissue, it's inflamed, heals with scar tissue. And after a while, the liver gets gets it's what we call cirrhotic, a lot of scar tissue. And eventually, some people, when they have cirrhosis, it can cause what we call decompensated cirrhosis, where the liver isn't able to do what it needs to do, or they have a higher risk of liver cancer because one of those scar tissues could become. So the reason we want to get people diagnosed and treated and cured, because we actually have a cure for this virus, is because you can actually change the course. And since we've had these curative treatments, the number of liver transplants from hepatitis C in the US has gone down.
Oh, wow.
The number of people hospitalized with liver disease has gone down if they're on treatment and they can be cured of the virus. So one of the things we see is that when people come in, because this is an infection they've probably had, like this gentleman, for many decades, is about 1 in 4 to 1 in 5 people at the time they're starting hepatitis C treatment have cirrhosis because you're picking up an old infection. The good thing is that the regimens and treatments that we have now have excellent cure rates of 95% cure rate, even with cirrhosis.
Okay, I was just going to say, like, what does that mean?
So
when you say
cirrhosis,
cure? Okay.
cirrhosis does not mean we can't treat. Actually, most of the people who got treated in Illinois up till a year ago were only people with cirrhosis and advanced disease, because we had issues with Medicaid covering the treatment at some point. So for this gentleman, cirrhosis is still treatable. We can cure the virus, and there are things we put in place to monitor the liver for liver cancer. So when somebody has liver cirrhosis and we cure the hepatitis C, their risk of cancer goes down significantly. By more than 70%.
Which is important.
Their risk of liver failure goes down by 90%. Their quality of life improves, and even after they're cured of the hepatitis C, there are protocols we put in place to do ultrasounds to check their liver. But obviously what's important is to be able to diagnose people before they get to cirrhosis. However, knowing that 1 in 4, 1 in 5 present with cirrhosis, we are treating and having excellent cure rates with people with cirrhosis. In our health system, within our hepatitis clinic, we have, with these new medicines in the last 3 years, we have over 850 people that we've treated and cured of Hep C. And for World Hepatitis Day in July, we hope to be at 1,000 by then.
Oh, wow.
And so these treatments are short. They're 12-week treatments, 3 months.
Okay.
So the old treatments up till 2014 included interferon injections. People had to take weekly for a year.
Okay.
And cure rates weren't that great. With these new treatments, we're talking about daily treatment, sometimes most times 1 pill a day. One of our treatments is 3 pills a day, once a day for 3 months. In some people without cirrhosis, 2 months. So we have treatment rates as short as 8 weeks. Most of them are 12 weeks, and cure rates of over 95%. So the main thing is obviously being tested to know that you have the virus, and then having access to care. And that's one of the things people feel sometimes like, well, I don't have a doctor, I don't have a healthcare provider, I got tested at a community event. What next? And so, because Cook County Health, we're right here in the community. We have clinics, all over the city and, the west side, the south side, and central campus. And so we have access for people to be able to call in to get a primary care appointment, see a primary care provider to confirm the diagnosis, make sure they actually have the virus, and then refer them within our health system to get treatment and cure.
So what, somebody that may be watching that actually in going through the treatment, is there anything you could share with them? Should they eat, exercise, anything they should do differently?
No, those are excellent questions, because one of the things we do is when we confirm the diagnosis, as we're checking for hepatitis C, we check for the other viruses. So with the hepatitis C test, we do an HIV test. We also do hepatitis A and hepatitis B tests, right? To see if they've been exposed to any of those and if they need to be vaccinated, because those two have vaccines to prevent them. So at the time when someone comes with a Hep C diagnosis, it's also a time to do primary care for the other things, right? So we check for HIV. Sometimes we find out people are infected with both at the same time, and that's how they got tested at a community event or at their primary care office. We check to see if they're vaccinated against hepatitis A or B, and if they're not, we do that as part of the stuff. We counsel around alcohol use. So alcohol is something that as soon as we have a diagnosis, because we're talking about the liver is inflamed already, alcohol is a big thing that inflames the liver. It's a big, people don't think about it as a drug. It's a drug that the liver has to break down. Every time you drink, the liver is what breaks it down to get it out of your system.
Okay.
And so when you have a liver infection, what you don't want is another injury. So alcohol, regardless of where you get your care, regardless of when you start treatment for Hep C, anywhere you go for hepatitis, the doctors or nurses are going to be talking about how much do you drink, alcohol cessation, helping you to get into a program if you can't do it, and explaining to you why. Because what you don't want, if you look at the top 2 reasons why people get a liver transplant in the U.S., it's hepatitis C, alcohol, and now fatty liver. That's another thing that's going up, is fatty liver disease, right?
Okay.
And so you have a cure for hepatitis C. If you don't address the alcohol, get the Hep C cured, they're still on the track to cirrhosis because they're still drinking,
alcohol,
you know.
right.
So alcohol is, we talk about alcohol cessation, we talk about discussing with your healthcare provider before starting any new medications, especially when people have cirrhosis or advanced liver disease, because the liver has to break down a lot of things. Eating right, you know, avoiding a lot of fatty foods. There are a lot of supplements out there that people say helps with the liver, and you know, a lot of them don't have a lot of data around them, so we kind of discourage those. Some of them we actually know could be harmful. We do tell people to, you know, fluid intake is always important. Talking to your doctor or provider before you start any new medications. No alcohol. You know, helping people get into substance use programs if they're still actively using, so that they're not getting reinfected. Because one of the things we know is that people think sometimes that if they have Hep C and they're cured, they're immune to it. Kind of like, oh, I had it once.
It won't come back.
You can't get it again.
Oh, wow.
So the virus is, when it's cured, but it doesn't stop you from getting infected. So you want to counsel people, you know, getting them to substance use programs, which we have a lot within our health system. We have big substance use programs to help people with substance use disorders, to help them get through treatment, but to prevent them from relapsing and to be safe, you know, in terms of their use. So those are things we counsel people on. We also talk about harm reduction around weight loss and exercise, because when there's fat in the liver, that can also cause scar tissue. Anything that causes irritation of the liver can heal with scar tissue, and scar tissue over time causes the liver not to do what it needs to do. We actually in our clinic have a model of what a healthy liver looks like and all the other stages, so that people can actually feel what, you know, if we're on the inside, this is what your liver looks like and what we're trying to do.
Okay.
So there's a lot of stuff that we do at that visit. We test for other viruses, we vaccinate, talk about substance use and harm reduction, talk about healthy lifestyles and how to kind of keep your liver healthy. So, you know, and for some people, even when they come in to get tested, if they don't have hepatitis C, it was an opportunity to engage in primary care and to talk about your liver anyway.
Okay. Well, being that you work for Cook County Health, and the medical insurance, it has changed over the years. I actually worked for Los Angeles Public Health years ago when I was in college, and I know that, and I worked in what we consider then a health clinic in the urgent care department, and people were just flooded if they didn't have insurance. So is the Cook County facility or the healthcare a place where people can still come with no insurance? Is there help for them to get insurance?
Yes, all of those things. All of those things. We pride ourselves as we are a safety net system, which means that we will never turn anybody away because of their inability to pay. That is something, and that's one of the reasons I feel very fortunate to work in that health system, and I've stayed 20 years. Because of that, everyone is treated with dignity and respect, regardless of their ability to pay. And so we're also part of the, you know, Affordable Care Act. We have our own, you know, the county care insurance plan. It's part of the Cook County. So what we do is that as part of the process, there are eligibility things to make sure if people do qualify for insurance, help them apply for insurance, help them apply for Medicaid, figure out what insurance, Medicare, whatever they might qualify for. People may not know what they qualify for, but even if they don't, we figure out their care, we cover their care within the health system. We work with medication assistance programs to get them what they need. So, and in our system, we also have, you know, walk-in clinics in terms of where people can come in just for a screen, for a sexual health screen. So they can come in and get an HIV, hepatitis test, and at that visit can hook them in. If they're HIV, we can get them into one of our clinics where we provide HIV care. If they have just one of these viruses, we can hook them up with primary care. because we do want them to see a primary care provider.
Right,
and we really do try to streamline the process so that when somebody comes into our clinic for their hepatitis treatment, like the gentleman who called in, we have a fibroscan, which is a test we do right there in the clinic to test what stage your liver is. We used to have to do a liver biopsy, and people would go and come back, and we lost a lot of people that way. Once you say biopsy, that's it. Put in what where? They're gone. And so there are lots of people who we lost that way. And so actually, with the fibroscan in our clinic now, it's a test that takes less than 5 minutes, right there in the clinic. Gives us, so a person comes in, we know what virus they have. They have hepatitis C. We check what type it is. We start the vaccination at that visit if it's needed. We do the fibroscan, which gives us the stage of their liver disease, and then start talking about treatment. And 3 months is the treatment. We wait another 3 months after they're done, and if the virus is still not detected, that's a cure.
Okay.
And for those people who start with very mild disease, that's it. We tell them, you can't get infected again, so harm reduction. And for those who started off with cirrhosis, even when they're cured, we still put them in a program every 6 months to check their liver for liver cancer and all that. The risk is down, but it's not zero. And so we put them in a screening program even after they're cured.
So are there any challenges as it relates to insurance with people getting treated?
Yes.
Okay.
And if you asked me this a year ago, I would have gotten on my soapbox and called out Medicaid for restricting treatment. But that took years of advocacy. So I know your organization does that. And so for the longest time in the state of Illinois and a lot of other states, because of the cost of the new medications, when they were approved in 2015, this new medication, that initial one that first came out, was a course that cost $90,000 for the 3 months.
Wow.
So it pretty much came to $1,000 a pill. So insurance companies had to, right?
Oh, yeah.
90 days, $90,000. But that was because there was no competition, and that was the first one, and the cure rate was so high from what we had before of a year of injection. So it was priced where it was priced. Now we have, many other medications. All of them work just as well. More than 95%, 99% cure rate. So prices have come down. And with that, and a lot of advocacy from HIV groups, from community members, from advocates, like your organizations looking out for the community, really going to Medicaid and saying we cannot deny treatment. When people come into us, that was heartbreaking to have somebody come in. They did their part. They asked for a test. They got the test. They confirmed they had the virus. They got their scan. And then we said, well, actually, we can't treat you yet. We're going to wait until you have cirrhosis, because but that's changed. So last November, December, Medicaid took out all the restrictions. And so since January of this year, if you have hepatitis C and the virus is confirmed, then everybody has access to treatment, which is great. And so the main thing is people knowing about it and knowing that they can come in for treatment. And even the uninsured, we work with the medication assistance programs for each of the companies that make this drug to be able to get. We have a full-time pharmacist who is always really looking out for the patient so that we can figure out how to get them medications. Because we have a lot of people in the county health system who come from other parts of the world who are not insured and cannot get insurance, but they're patients, they're in our health system, and we work on ways to make sure we get them the services that they need. So the insurance stuff was a big deal.
2 minutes, what those final words that you would say to anyone that is watching?
So to the gentleman that called, if he's already in care and engaged in primary care, that's awesome. He can call, if he wants to get into Cook County Health System, our number is 312-864-0200 to get into a primary care appointment at any of our clinics. We have 14 clinics in the health system. And once you're established with a healthcare provider, they can refer you to our hepatitis treatment program. But what I want to say is that, ignorance is not bliss, right? So not knowing is not a good thing. Hepatitis C may not have any symptoms until it's very late. The most common symptoms are just tiredness, which most people are tired just from living every day. So we encourage people to get tested. And so we're going to continue to do more education for providers around the guidelines to test in that age group, to make it routine. And that, but the main thing is to have people kind of take take the power
Right,
and not assume
absolutely.
that things are done.
Absolutely.
Ask about, have I had a hepatitis C test? If you've had one, talk to other people about it.
Right.
Word of mouth is great. Share information. I got tested. I'm negative. Whatever. Did you get tested?
Right.
So the main
Right.
thing is we can't get to cure and reduce your liver damage and get you the best outcomes and talk about vaccination if we don't even know that there's a virus
Right.
you're living with.
Right.
And this virus over time will cause problems in a significant amount of people. So the main thing is getting tested, asking your doctor for testing, getting to primary care and getting access to the treatment. And in our health system, we do a fantastic job in supporting people through treatment and getting them the coverage that they need.
That's great.
Yeah.
Thank you so much. So all you baby boomers.
Baby boomers.
Get tested. Again, last month was Hepatitis Awareness Month, June 28th.
July 28th.
July 28th, the
It's
last
World.
Sunday.
World
And
Hepatitis.
July is World Hepatitis Day. So those commercials and billboards that you're seeing is for a reason.
Yes.
And the reason is there's a cure.
Yes.
And we need folks to get tested. Thank you so much
Thank you.
for being a guest. This has been the Doty Report on Comprehensive Health. We will be back here next Tuesday at 7:30. Have a great rest of the week.
Thank you.